So hi there, Neil and Euan here
Hi
again. Today we're going to be covering cholera.
In windy Leeds.
And you're going to be the expert today, Euan, and so I'm going to be questioning you a little bit about the disease of cholera. We're going to be using a slightly different model that we're going to introduce at this session. Do you want to run us through that, Euan?
Yeah, so we're going to use a framework, and I'd just like to say, first of all, by the way, we're sitting here by the canal in Leeds, which is very lovely and appropriate for discussing cholera disease. So the framework we're going to be using is the 5 T's of tropical disease, which is a framework we have developed to help learn about tropical diseases, and also a good way to help teach other people about tropical diseases and to pass on that information to your travellers in consultations. So the 5 T's is based on type, transmission route, treatment, traveller's risk, and take-home message. So we're going to go through those one by one to kind of take us through cholera.
Okay, brilliant. So thank you for that. So let's hit off with the first one. So tell us about the type of disease that cholera is then, Euan.
So when we look at type, we look at type of organism and the type of disease itself. So type of organism is a bacterial organism that caused the disease, and it's the Vibrio cholerae, and it's actually, there are 2 main serotypes that cause cholera, and these are the only 2 serotypes that are reportable to the WHO in terms of cholera epidemics. There are other serotypes that of similar bacteria which cause cholera-like diseases, but they don't tend to cause the huge outbreaks. Then in terms of the disease itself, it's a diarrheal disease. It's classed as, mostly very watery diarrhea. Usually infected people, most people are asymptomatic or have very kind of mild diarrhea symptoms, but in fact, if untreated, any of you have very severe symptoms, it can lead to much more severe consequences, quite a lot of dehydration. They talk about these rice watery stools, and that's when, if untreated, it can actually lead to death in some cases too.
Okay, so talk to me about the transmission route. How do we get cholera?
So transmission route of cholera, like many other food and waterborne diseases, is actually by the fecal oral route. So sounds lovely, but it's actually usually passed on by contaminated food and water, or people. It can be passed on from person to person, but it's basically fecal oral route. And the other interesting way of getting it is by shellfish or seafood which has been living in and around waters and feeding where there is human waste, and that's another way. So actually seafood has been the source of quite a lot of outbreaks and epidemics in the past, as has unwashed vegetables as well.
Right, okay. And I was just reading today, I was looking at the Green Book before this session, and there's a pretty scary statistic in there that 50% of all people that get the severe form of the disease can die within hours. Is that right?
That is true. If you do get, you've got to look at it in context. So people who are in the developing world, who don't have good access to healthcare, don't have access to antibiotics, etc., or intravenous fluids, if they got the severe form of the disease, it can be, very dangerous indeed. However, we've got to bear in mind that most travellers, for example, will hopefully have access to good healthcare, or somewhere where they can probably pay for intravenous fluids and antibiotics.
So that brings us nicely on to the 3rd T then, of treatment. So give us a brief summary around treatment then. Yeah,
and also just before we do that, I just also like to kind of point out that the cholera that we have nowadays, the strains and the serotypes that we have since the 1960s have actually been a different strains to the ones we've previously had. So cholera itself isn't as deadly as it used to be. It used to wipe out far more larger groups of people. But yeah, so coming on to treatments, specific treatments, we'd be looking for most people as oral rehydration solution. So basically either using clean purified water and making up your own oral rehydration solution using 1 teaspoon of salt and 6 teaspoons of sugar for 1 litre of water, or also you can use packs of oral rehydration sachets that you buy in chemists. If you do have more severe, you will need antibiotic therapy, and the various antibiotics include doxycycline, erythromycin, and azithromycin, and also intravenous antibiotics as well.
Okay, great. So you mentioned the vaccination then?
Yeah, so the vaccination. So there is an oral cholera inactivated vaccine, which is available in the UK and in many other countries around the world. It's a safe inactivated vaccine. It comes in the form of a drink, and you make it up with sachets. You can buy it for 2 doses for about £50 at many clinics, but it is also available.
Right, I was going to say, isn't it available from your GP, that one?
So yeah, it's actually one of those vaccines that's listed as being that GPs and the NHS can give for free. However, there does have to be a very clear indication of risk, and we're going to come on to risks actually in a moment.
Okay, and is it suitable for use in children?
It is suitable for use in children. There's a slightly different regime for children, so you have to follow the regime for and I think it's children. I can't remember. Over the age of 6, is that right?
2 to 6, I think.
2 to 6 has a different regime, and then over 6
it doesn't give us longer term protection, I don't think.
That's right, yeah.
For that period of time.
Something like that. Read the PGDs before you just follow us blindly.
And am I right in thinking that the cholera vaccine gives a bit of protection against travellers' diarrhea as well?
Well, there has been various amounts of research done in the past about that, and they used to think there was quite a lot of crossover protection for ETEC bacteria. Now, which is a cause of a lot of travellers' diarrhea. In fact, looking at more recent meta-analyses of that research has demonstrated that they can only really guarantee about a much lower percentage, something like a 7 to 10% crossover with that, and it's not licensed in the UK to be sold for the purposes of protecting against that type of bacteria.
Right, okay, that makes sense. So, moving on to the fourth T then, the traveller's risk. Can you give us an idea about what actually is the risk to travellers? Which group of people are going to be at most risk? And I mean, should everybody go to their doctor if they can get it free of charge from the NHS and have it?
Well, they're probably not going to be likely to give it to them if they're not coming under one of these risk categories. So really, you're looking at the highest risks of travellers are going to be those going to work in refugee camps, doing humanitarian work, places where cholera outbreaks can happen quite quickly, and also anyone who's going to travel to an area where there's already reported outbreaks of cholera. So these are the ways
typical places at the moment.
So at the moment there's various countries in Africa, Central America, and some countries in Asia which have ongoing epidemic. It's endemic in these countries, and they have various outbreaks. I think there's been outbreaks in Nigeria, there's been outbreaks in Mexico and various other parts of the world.
And after the disaster in Haiti, is that right in thinking is that still ongoing?
That's correct. There's a huge outbreak that happened following the disaster of the earthquake in Haiti in 2010. It built up hugely in the town of Port-au-Prince, I think it's called, in Haiti, and then since then it has actually spilled over into adjacent Caribbean countries such as Dominican Republic and Cuba. So it's an ongoing epidemic that's happening there.
Interesting, especially when Cuba's got such a world-renowned public health system.
But it's still spilled over. So interesting.
Fantastic.
So these are the people that would be at the most risk.
Okay, that's good to know. So then moving on to for our travellers that we're seeing in the clinics, what's our take-home message for them? And what are the key things?
So the key things we'll look at. So it's a bacterial disease. All the ways you would, passed on by contaminated food and water. All the ways you would normally prevent that. So good hand hygiene, avoiding salads and ice, not drinking purified water. All these things that you would normally do to prevent food and waterborne diseases are what we should be doing. It is a treatable disease. Most travellers are very, very low risk of having the disease, but if you are going to be one of the more higher risk people, or you just wish you just want to be protected against it, then it's a vaccine that you can have, and it's a safe inactivated vaccine, but still do all the main preventable methods for stopping having the disease.
Okay.
Yeah.
Brilliant.
So that's cholera in a nutshell. Thanks for listening, and we'll see you next time.
Yeah. Thanks a lot.
Bye.
Bye.